My name is Keri Brophy-Martinez, and I'm currently the Program Director for the Medical Lab Technology and Phlebotomy programs. I graduated from the University of Texas in 1995 with a bachelor's degree in medical technology, and I started working at Brackenridge Hospital, which of course doesn't exist anymore, but that was where my first job was, working as a medical technologist on evening shift. I worked there for about 5 or 6 years. Prior to that, had a little bit of phlebotomy experience, but at about my 5 or 6 year mark at Brackenridge, I transferred to another regional hospital, another major hospital within the city of Austin, also working as a laboratory technician or medical technologist. And at that point, I was doing what we call generalist work, where I was doing multiple areas within the laboratory. And towards the end of my career working in the laboratory, I was a supervisor for the phlebotomy staff and also a supervisor for special chemistry. We process blood specimens. We can also do body fluids like synovial, that's knee fluid. We can test fluid that's around the heart. We can test spinal fluid, lots of different body fluids we can test in the laboratory. In other areas of the lab, like microbiology, we can set up cultures on pretty much any kind of fluid or tissue that comes off or away from the body itself, looking for bacterial causes of disease. We also have our immunohematology or blood bank that's within our hospital systems, where we can do blood typing, not only for people that might be a donor to be able to give blood, but the recipient. So if you have somebody that's in the hospital that's requiring a blood transfusion, it's our technologists in the blood bank that are doing the blood typing. That's kind of layman's term, you could say blood matching, to make sure that if you are an A positive, that you're getting blood that's going to be compatible with A positive. If you don't, that's usually not a good thing. You can actually have a patient that dies if they get incompatible blood types. The majority of the employers that I mentioned, entry-level education is an associate's degree in medical lab technology. You can have a bachelor's degree in clinical lab science. That would be the next level up, but the minimum level is having the associate's degree. As I mentioned, we do have a phlebotomy program at the college, and that's a really good place to start. We have lots of people that come to us that are really interested in healthcare, and many of them are really unsure of their path. Do they want to have 100% of their workday being directly working with patients, or do they want to have more of a position that doesn't rely so much on direct patient care? Just to explain this a little bit more, because we hadn't really addressed this. In the clinical lab, we're doing lots of testing on patients' samples, but we very infrequently see patients that are in person. And so if you know you want to go into healthcare, but you're not sure about that person-to-person interaction, the lab is a great place to be, because we work a lot with our coworkers and members of the healthcare staff, but we don't always see the patients. If that's not what you want, if you're like, no, I'd really want to be with patients, then starting with phlebotomy is a really good place to go, because when you are doing venipunctures with patients, then you have to have a conversation with somebody. Sometimes you have to be sympathetic and empathetic to their stories while you're working with them. And then, as I mentioned, the phlebotomy program or the phlebotomy certificate profession is a really good way to start going forward, because you can get a certificate, you can be working out there in the field and really figuring out what direction you want to go. If you decide you want to do clinical lab science, then it's actually a pretty direct path into our associate's degree. It's one of the prerequisites for our program, that you can get the associate's degree in clinical lab science. For our program at ACC, it takes about 5 semesters with prerequisites and to go through the program. And then most of our graduates choose to go to work fairly soon after finishing our program. We do have a couple of university systems that we work with primarily in the state of Texas, that are very attracted to our graduates and students that want to continue their education to get the bachelor's degree in clinical lab science. We work with them and these other universities to do a bridge program where all the clinical experiences that they logged during the time that they were with us and their previous coursework gets counted towards their bachelor's degree. So instead of spending 4 years in college getting a bachelor's degree, you can maybe spend about a year to a year and a half after you get the associates and finish up with the bachelor's degree. And the best thing about that is that many of these programs are distance programs. So the students or graduates can still be working here in the greater Austin area because they have their associate's degree, and then they can be doing their schooling for the bachelor's degree on the side, being supported by the hospital or clinic where they are employed. It's a great, great fit. In our world, that's really the most important thing with clinical lab scientists. You have to be accurate and you have to be precise. We're dealing with a lot of numbers, and you have to make sure that you are reviewing all of this data as we're reporting patient results out and making sure that you catch if you have a patient that has a critical glucose or maybe has a hemoglobin that's really, really low that they could be, bleeding out somewhere. So being accurate, being precise, probably the number one thing, attention to detail. Like I mentioned, we deal with a lot of numbers. We also deal with a lot of machinery, not only computers, but, big pieces of equipment. And you have to be paying attention as these machines are working. I tell our students all the time, it's kind of like your vehicle. When your vehicle starts sounding a little weird, it's probably time for a tune-up. Well, we get used to the sounds that our machines make, and you'll notice when something just doesn't sound right or seem right, and that's that attention to detail. And you have to be proactive with maybe doing some troubleshooting before your machine ends up breaking. And if it's down for any length of time, that can obviously impact getting patient results to the physician. Patients, there's many things, like I said, we deal with a lot of instruments, we deal with a lot of equipment, and they like to break. So you have to be patient. That's part of our job, actually. It's not just doing the testing, but it's maintaining our equipment and making sure they have a clean bill of health. And lastly, problem solving. I like to think of every patient that we have that we're working on, we're getting pieces to a puzzle. We might be getting information from hematology, which are information related to their white blood cell count or their platelets or their hemoglobin. And then we're taking information from chemistry, their glucose, their sodium, their potassium. And we're putting this all together to give it to the physician to hopefully help him diagnose a patient or perhaps even follow up with a treatment regimen. And possibly give them a prognosis. A lot of what we do in hematology is identify blood cells, and some of these blood cells can also be indicative of a leukemia. And maybe this is the first time this patient has been in to see the physician, and when we see these certain types of cells, that really only means it can be a leukemia. As far as the soft skills, I would say the soft skills would include being a team player. We often work kind of under a skeleton crew, which means we don't have a lot of humans working in the lab. A lot of our work is done with instrumentation, but we have to have humans there to monitor. Like I mentioned a minute ago, if we start hearing a strange sound. So you have to be able to work as a cohesive group, working well with others, being a really good communicator, whether you're writing down communication or verbally giving communication. We have to do both. A lot of times we do happen to have a patient that comes in and we need to give them directions on how to collect a certain type of test. And so we have to make sure we're able to give clear communication. Probably one of the number one things they have to consider is patient interaction, because we have virtually no patient interaction with the person themselves. We have plenty of interaction with their specimens. And so if you really had somebody that wanted to be in the medical field, but did not want to have that one-on-one, face-to-face patient interaction for whatever reason, then clinical lab is a great place to be. Also, if you've got somebody that really likes to work with their hands and likes to tinker with things, clinical lab's another really good place because, as I mentioned, we have a lot of very expensive equipment, and I'm not going to lie, it breaks down. It's not because it's not quality equipment, it's just it's used a lot every single day, 365 days a year. And so you have to be confident in your abilities and not scared that you're going to break something just because you're trying to work on why this particular instrument is not, taking a sample like it's supposed to. That's part of the expectation as a clinical lab scientist, is that you're going to try to troubleshoot the machine first. And then if you just can't figure out what's wrong with it, then we call our service technicians. But service technicians could be as far away as San Antonio or Dallas or Houston. And it may take them a half a day to a day to even get to your site. So tinkering with the equipment and virtually no patient interaction. If those are things that appeal to you, then the clinical lab would be a good place to be. We also do a lot of microscope work, looking under the microscope, looking at blood smears, looking at urine specimens, looking at gram stains in microbiology. And if you really enjoy microscope work, then that's another really good place that you're going to find that. The only other place that you could do microscope work would be if you had gotten a degree in biology. And I will say that probably about 50% of the students that we have that are attracted to our laboratory program already have a bachelor's degree in biology and have trouble finding jobs because they don't have the clinical experience that these labs are looking for. So, those are the types of things that I would say would be qualities that a person would have to have or to enjoy working as a clinical lab scientist. I would say come see us at Austin Community College. We have a health sciences webpage, and on that health sciences webpage, we have all of the program options that are listed. And if they were interested in medical lab technology, we have an online information session that the student or potential student can review. It takes about 45 minutes to an hour, tells you a little bit about the profession, tells you about our program at ACC. And then once the person finishes that, they'll be contacted by either myself or one of my faculty to do, currently it's a virtual advising session where we look at any previous coursework that's been done and any other information that could, positively affect them not having to take extra classes. And then we make up a plan for them and kind of discuss when the point of entry will be. Our program, we only have one entry point a year, which is every fall semester. Every cohort starts in the fall. So that would be what I would say to get them started.